Are you thinking of taking contraceptives, but you don't know where to start? You don't know which one is good for you? I'm Dr. VQ. I share with you health and wellness tips. So in this video, we will be talking about different forms of contraceptives. So we have short-term contraceptives, we have long-term contraceptives, we have hormonal, we have non-hormonal contraceptives. Short-term, as the name says it, it's something that you should not use for long. That includes your oral contraceptive pills and your injectables. Oral contraceptive pills and your injectables, as well as your emergency contraceptives. You should not use these in excess. You should not use this for long. By long, I mean not longer than 2 years. If you go beyond that, there are problems. You are causing problems. You may not see it, but you are causing harm to your body. All right. And then we have long-term contraceptives like your implant and your IUDs. This includes a hormonal and non-hormonal IUDs, right? So the easiest one, which is not so reliable, is the barrier method of contraceptive. That is the condom or the diaphragm. That is a very, very simple one to use, non-hormonal, and it will not really affect you. The downside is that it might burst and it might not really prevent you from pregnancy if it does burst. Okay, so we also have a spermicide, which is like a lubricant kind of thing that you just apply before the deed. That helps to kill the sperm. So it's not really hormonal and it will destroy the sperm. Downside is you have to remember to use it even during the deed, just before it. So you must always remember to use it. Same as the barrier method. It's easy to forget, so it's not really reliable. Third, we have contraceptive pills, oral contraceptive pills. This form comes in different brands and different combinations. We have single hormone and we have combined oral contraceptive pills. By single meaning it's just progesterone, and then we have ones with progesterone as well as estrogen, which I think is the best because you need both the hormones. With this method, you must always remember to take your pills. So you must take it from the first day you start bleeding. First day of your menstruation is when you must start taking the oral contraceptives. Can you take it any other time of in the cycle? Yes, of course you can, but just remember to use a different form of backup contraceptive, being a barrier method, for at least 7 days after you have started on the oral contraceptive pills. So we also have injectables. It also comes in different forms, in different potencies. We have 2 months injections, we have 3 months injections, right? These are high in estrogen. You do get an injection which is a combined injection, meaning it contains both estrogen and progesterone. But with the injection, you must always remember to go for your next dose. That is the downside. And remember, it's a 2 years max. You should not take it longer than that. So long-term contraceptives, we have implants. With the implant, it's a size of a matchstick that you insert, that the doctor or nurse will insert under your skin. That will release hormones throughout that length, that duration. It comes in different durations. It can last up to 3 years. So at least you don't have to always go back to the doctor for another dose. Just remember to take it out when it's expired, when you should take it out. Some last up to 5 years. Same goes for intrauterine device. That is your IUDs or IUS. That is a T-shaped small device We have a hormonal one, which is a plastic form. We have a non-hormonal, which is usually copper. It is then inserted inside all the way up to your uterus. It is inserted in the uterus and it prevents implantation from occurring. So even if the egg gets fertilized, but it will not implant unless, of course, a miracle happens. Who can stop miracles? So the downside here is the pain. This lasts for a very long time. It can last to from 3 years, can last up to all the way up to 10 years, right? Depending on whichever one you choose to use. The downside is really the pain during insertion for some people, because we don't always react the same. Some people will have extreme pain, some will not really react. So yeah, that's the downside. But it does give you protection for a very long time, and you don't have to always go back to your doctor for another dose. So with all these contraceptives, there are side effects associated with that. Some side effects may include acne, abnormal bleeding. This can be heavy bleeding. Some people may experience no menses at all. It may lead to weight gain, and other people, when used for a very long time, it may cause demineralization of the bones, meaning that over time, especially around your menopausal stages, it may lead to osteoporosis because the bones are weakened. If you love this content, please do not forget to like, to share, to comment your experiences regarding birth control, and to also subscribe to receive or hear or watch more of these videos on how to improve your health through natural health and wellness. I am Dr. VQ. Bye.